Hi there. We're on chapter 11, which covers eating disorders. We'll discuss anorexia nervosa, bulimia nervosa, and binge eating disorder. I'd like to take a step back and say that eating disorders, especially bulimia and anorexia, are most frequently diagnosed in young age, especially in women, anytime between teen years and late 20s. We can see them throughout lifespan, but they're sort of a disorder that's overly represented among young people, especially women, although men can be diagnosed with eating disorders as well. In terms of understanding sort of the causal factors, research suggests that both environmental factors and genetic factors play a role in the development of an eating disorder. Let's start with anorexia. Anorexia nervosa is characterized by the person being underweight, right? And they are underweight typically because they perceive themselves as heavier than they actually are. We call that distorted image, that a person will look in the mirror and believe that they are overweight even though they are extremely thin. So being underweight is a hallmark of anorexia. That is because the person typically is restricting, meaning they take very little food and they often exercise excessively. That's a second way or strategy that people use to keep their weight down. People with anorexia typically, and we see that with other types of eating disorders, have additional diagnoses such as substance abuse disorders, anxiety disorders, depression, etc. Okay, it's a range. We call that comorbidity, which basically means that a person has two or more disorders. It's not uncommon with any psychological disorders. We do see that quite commonly with eating disorders. Bulimia nervosa is a disorder that's characterized by binge episodes and purge episodes. So a binge episode is basically a time during which a person will eat large quantities of food, not the amount that would be normal or proportionate for, let's say, lunch or dinner. Typically, people will eat twice or three times as many calories for that particular episode, and they will, as soon as they finished eating, they will typically experience a high number of unpleasant feelings, and they will soon after engage in what we call compensatory behaviors. Compensatory behaviors can include induced vomiting, the use of laxatives, or excessive exercise, where people will go on a 3 or 4 hour run, go to the gym for multiple hours a day, etc. Again, bulimia, like anorexia, is associated with comorbidity. We see additional disorders such as anxiety, depression, and substance use. I'd like to talk very briefly about treatment for eating disorders. One of the most commonly used treatments is cognitive behavioral therapy that is specifically tailored to that particular disorder. Okay, one of the important things to consider is that people who have a diagnosis of anorexia or bulimia typically have a treatment team, which is basically a team of providers who work together, and each focuses on different aspects of the disorder. So typically there is a psychiatrist who manages medications, a psychologist or a psychotherapist who provides psychotherapy, both individual, sometimes group or family or couples therapy. There is typically a nutritionist. There is a physician who monitors the physical health of the person, etc. And it's important for the team, for the providers on the team, to work collaboratively and to be in communication to provide the best care possible for the patient. I want to briefly mention one more disorder, which is called binge eating disorder, that we don't see necessarily more often in young people. That's a disorder that we see throughout lifespan. It's a disorder in which people engage in binge episodes. So they sit down to eat large amounts of food, but they don't engage in compensatory behaviors such as people with bulimia nervosa would. Okay, I'm going to stop here and I will see you next time. Thank you so much for your attention. Bye.